السيشن اللي جايه beyond traditional method how the AI is revolutionizing speech therapy in pediatrics. Speakers Dr. Rodayna Magdy Elnaggar, Dr. Mohamed Elahmady, Dr. Ashraf Sameh rabie, Dr. Yahya Ayman Elghandour. They are medical students at New Giza University.
This isn't science fiction. This is a revolution happening right now in pediatric speech therapy. Let me introduce you to the world of speech therapy where AI is the ultimate partner in communication success. I'm Rodayna Elnaggar, and the aim of our presentation is to present you with the recent advances in speech therapy where AI is ultimately used in both diagnosis and management of disorders, and here we have autism spectrum disorder as an example.
Hello, we are here today to give a presentation about AI in speech therapy beyond the traditional methods. As you know, AI is revolutionizing medicine nowadays, but do you think that it will replace doctors in the future?
Doctors and professors, don't worry about AI replacing your jobs. AI is here to collaborate. Therefore, we will not be using the AI version of me today, and allow me to introduce you to the current traditions of AI, of speech pathology. All right, so a speech language pathologist, also known as a speech therapist, has a role, and their role is to diagnose and treat speech pathologies. And this was traditionally done throughout a face-to-face interview. But thanks to COVID-19 pandemic, which allowed and introduced a change, this forced a change from a face-to-face interview to a telemedicine, including applications like Google Meet and Zoom. Now, let me ask you, professors, what is the future? What is the future? The future is AI integration and video-based. All right. In Egypt, common issues arise, and these problems are basically lack of accessibility to a speech-language pathologist. The other thing is the financial burden these sessions have on the families. Therefore, tools that we have, like Assistal, for example, utilize deep learning approaches by analyzing these sessions in real time and giving feedback to the child or the students. And these sessions work mainly by facial recognition. And this is how the artificial intelligence software works. Now, let me ask you again a question to pediatricians and doctors. How many of you in your practice encountered a child with a speech language disorder? Many times. Therefore, thankfully, my colleague Elahmady is going to introduce to you some tools which you can apply yourself into your clinic.
Thank you so much, Rodayna. Okay, so the next slide is, this is the first example of an AI integrated speech therapy application. This application is called a SLT application. As we know, it's worth mentioning that one of the key principles of a very successful speech therapy is regular exercise. That means that regular exercise should be everywhere, in the clinics and at home, everywhere. So this is a new software, which is SLT, that is designed for pediatric patients with motor disorders, motor speech disorders, like dysarthria and dyslexia. And one of the advantages of this application that's not present in other applications is that it does an automatic assessment of the facial and the tongue muscles in order to provide an automatic feedback and assessment for the child to ensure that whether this child is doing the exercise correctly or not. However, the other applications that are available are not that effective. They are passively sharing pictures, videos that are just for some exercises without giving any assessment for the child. And as we see, this figures shows us a speech language pathologist and a child on the right bottom with using a webcam to perform the exercise. And there is the strawberry icon. Pointer. And this is a strawberry icon. It illustrates how the child will move their tongue during the exercise. So as this patient is having dysarthria, which is a motor disorder that's affecting the tongue muscles, so this exercise will be very effective. And on the right top side, there is the current exercise name, as well as the description of the exercise and the number of repetitions that are illustrated by the number of stars included here, and a progress bar. And there are some guidelines that are found or available in this application in order to indulge the parents of those children in the process of treatment. And here, what about gamifying speech therapy? What is gamifying speech therapy? It means that speech therapy can be like a game. Like a game, what do you think, like, which game? Like a game in a mobile phone, Candy Crush, Happy Farm, Subway. And that's exactly this application. It's called Apraxia World. It's another new software that integrates gaming with speech exercises. It delivers speech exercises in a very fun way that is less boring to the child and enhance the engagement of this child, and even they can gain points by exercising the speech exercises. So those are examples of the speech exercises, as we see, for some words, and this is a game. After each game and after each level, the patient is allowed to perform one of the speech exercises.
Let us now discuss the importance of AI integration in terms of diagnosis of speech disorders. So in this example, we'll be using autistic spectrum disorder. The main machinery that we're using here is machine learning models. So as you can see here, we have multiple machine learning models. Each machine learning model works by giving it data. This data is in the form of video recordings, sound recordings, voice recordings. So basically, we're teaching it the difference between an autistic child and a normal child. Then we start testing these different models by giving it two groups, as in like the true nature of the field. Children with no disability, no autism, and children who have autistic spectrum disorder. And then we start comparing the specificity and sensitivity between the different models. And finally, the winner of the race is a model that could give us, with the highest sensitivity and high specificity, a clear diagnosis. This serves us and serves physicians how? It's a screening tool. We could use it as a screening tool for physicians who are not child psychiatrists, who don't have the time right now in the field to assess the child. And later on, he could refer them to a specialist, and the specialist could provide them with the care they need. But not every technology only comes with pros. There are several limitations to this technology, including that there is a lack of availability of speech corpora. We don't have enough data from voice interviews, from video recordings of children who are already or have this disability. Another important thing is we cannot distinguish, this technology cannot distinguish between children and adults. This is important for transcription, the transcription process of this technology and the data analysis later on. Another thing is that it cannot distinguish between different child groups, children from different age groups, which is important also in the diagnosis and the accuracy of diagnosis, and later on to implement a personalized treatment plan. The last two problems could be overcome through application or enhancing the ability of this technology to have visual and facial recognition. Not only are we allowing the machine to work by hearing, but we also allow it to see the situation and to assess it better. Another thing we could do is collaborate with speech pathologists to obtain more data in order to improve the accuracy of the machine and at the same time to broaden our range of diagnosis of different speech disorders. طيب. In conclusion, no. Okay. شكرا. طيب, let's conclude our talk by saying that AI is a significant tool and it could change how a physician operates in his field. However, it still has lots of limitations, and these limitations could be overcome through more research to enhance this facial recognition feature, and at the same time to collaborate with more speech therapists to obtain more data to enhance the accuracy of this tool. Thank you so much. I would like to thank the Professor Ayman Emil, Professor Ahmed Hamdi, and Professor Mohamed Omar for making this possible today. I would also like to thank our Dean of Medicine, Giza University, Dr. Alamia Mohsen, and a special thanks to Dr. Antoine for providing us with continuous support throughout the process. And also I have to thank our chairman, and thank you all for listening.
لسه هتكون له صوره جماعيه.
شكرا لحضرتك.
أحب أشكر الدكاترة طبعا على البرزنتيشن الحلوة بالنسبة لقصر عيني ونيو جيزة.